As it is our custom here at Remar Review, we are coming live to you from Facebook to help you with your NCLEX journey. Like, that's what we do here. So let's talk NCLEX. We have so much to cover in just a little bit of time, so stick around for a few minutes. But you know what? I really want to just say how encouraged I am to everyone who is passing their NCLEX exam. You guys may or may not know me. I don't know if it's your first time, but my name is Regina Callion, and I am here as the NCLEX expert, the NCLEX mentor for you. And I am so happy about all of the nursing students who are getting their license. I'm seeing the testimonials, I'm getting the emails, I'm seeing all of the posts in the Remar Nurse Study Group. And this week, I was just really excited that you guys are crossing over into the field of nursing officially, and it's just amazing. So congratulations to everybody for making that transition, making the sacrifice, and doing what you need to do. If you want to connect with me, and if you want me, you've been watching Remar Review for a long time, and you want to get the individual help on the study plan that you need, the study products that you need, please check out the website, okay? remarreview.com. That is where I put my best information as a system for you to buy and get your nurse journey on the way. And it doesn't matter, you guys, if you're just beginning your studying journey for NCLEX. It doesn't matter if you already have a couple of resources and you're trying to put them all together, or if you have failed the NCLEX already and are trying to study again. There is a product that I've created that is specifically where you are and will help you. I will help you. So do yourself a favor and make this process a lot easier by staying in the Remar Nurse community. I'm telling you. So I want to shout out Nurse Rodriguez. Usually we do testimonials of people who passed, but what I'm so encouraged by are you guys who are in the journey now studying for your exam. Hi, everybody. So Nurse Rodriguez put this up, and it's just really cool because she just put like, it's study time. It is study time for me. And she has the Quick Facts book. She has the Quick Facts book and then also the companion DVD to go with it. And I just want to say, like, if you're really serious about your NCLEX, you have to have Quick Facts. That is one of the books that is a staple for preparing for this exam. So when I went to the NCLEX conference, I took a whole bunch of the Quick Facts books with me, and I'm telling you that the nurse educators were taking them like, I don't know, like it was gold, because they just saw, like when they opened it up, they saw how easy it was, and they were asking each other, where did they get the books from? And it was so crazy because, you know, at the NCLEX conference, you couldn't have like a table or anything like that. And people, I'm telling you, I had my own table just because I had Quick Facts in my bag, and people were just coming up to me and we were talking about the book. So it was so funny. But seriously, Quick Facts is its own celebrity. If you are studying for NCLEX, you want to make sure that you have that book. And it's super easy to get. It's super affordable. Go to the website, remarreview.com, or go to Amazon and pick it up. You will love it. So shout out to Nurse Rodriguez for studying with that book this week. Another testimonial. Oh, this one is so, Nurse Butler. She's so amazing because she posted a picture. She sent a picture to me of her actually with the boot camp certificate. And she is also in the makings of being a Remar nurse. So there she is with her boot camp. And you guys know, the boot camp is a free resource that I do. The NCLEX boot camp is a free resource that I do for anybody who's studying with the Remar products. So it's essentially, you get weekly emails and you complete the assignments in the emails. And at the end, you do get a certificate saying that you have gone through the boot camp course. So Cool. I was really happy to see her. So proud to have it because it is just another step. It is another resource that we provide that you're able to use. So check out that smile. And look how she's dressed. Look how she's dressed. She is in scrub apparel. I don't know, Nurse Butler, if you are already an LPN and you're using the Remar products to take it to the RN. I don't know if you're a CNA and you're using it to get your LPN, but you know what? It doesn't matter if you're a CNA, a LPN, or trying to be an RN. We got you covered here. So isn't that wonderful to see nurses who are with you studying with the same products on the same journey? So shout out to those nurses who are making the commitment to yourself, because it's so easy. Like there's 153 people on here now. And it's so easy to just come and gather and just kind of sit and watch. But it is another thing to literally take action on your goals and take responsibility for what you're trying to accomplish, because it's not going to just come through osmosis. Like I do this for the people who have made a commitment and they need a boost or they need a push to get them to the next level. So this is why we do Let's Talk NCLEX here, Remar Review, for nurses like Nurse Rodriguez, Nurse Butler, who are already grinding and who want the community, who want the support. So, all right. So you guys know what it is when we share our testimonials. We love for you to send them to me. And we send y'all a really cool Remar Nurse shirt. We tell your story. We congratulate you. And your story inspires so many others who are watching who may think that I cannot do this. I'm too far out of school, or it's too difficult, or I don't have the time. I mean, whatever excuses that we go to bed with at night about why we haven't gotten our nursing license, your testimony can answer that. Your testimony can shed light on the true possibility of having a nursing license. And it is a great thing. It is a beautiful thing. So let's get into Let's Talk NCLEX, because that is what you are here for. And I am prepared to give the people what they're calling for. I'm going to start by giving you an NCLEX pro tip that I find we are missing out as we prepare for NCLEX. Like really. And the reason why I know this is because I will do a question and then I will get a whole lot of backlash about it. So this is in lieu of that. So here we go. All right. So last week, you guys remember, this was the question that was posted on the Remar Nurse Instagram page. And I like to cross educate. So if it's on Instagram, I shall put it on Facebook and maybe vice versa. But here was the scenario. A 52-year-old is being evaluated in the emergency room. He suddenly becomes confused. His current vital signs are as follows. The blood pressure is 80/62. His respirations are 99.0. So that's a very accurate respiration. His pulse is 116 and his pulse ox is 95%. So the nurse sees this on the monitor. Now, every Remar nurse in the universe will look at this strip and say, this is an example of what? Yes, this is an example of VTAC. So we are clear on that. Now, it goes on to say, which is the recommended treatment for this VTAC, Nicole? What do you think it is? These are the choices here. 1 is epi. 2 is defibrillation. 3 is lidocaine. 4 is amiodarone. What saith you guys is the recommended treatment for this condition? And there's so much controversy on this question today. I said, we need to look at it again. I see the answers: defibrillation, lidocaine, cardiovert, right? Amiodarone. Okay, so here's the thing. Here's my pro tip for you guys, all right? You have to, when you're taking NCLEX, you have to be able to pick the best answer from the choices that you are given. That means do not waste time sitting there saying, why doesn't it say this? Or why isn't this one of the choices? I find nursing students doing that all the time, and it is not going to be useful to you. It is not going to be useful to you moving forward or when you're actually taking the exam. You have to look at the choices and pick the best one from what you see there, okay? Because you're not going to get any credit for doing anything else, okay? So, looking at this question and looking at every other question moving forward, this is how I want you to think. All right, so here are choices. How do you treat this? How do you treat this rhythm, this irregular rhythm? Yes. From the choices that we're given here, the best choice is going to be defibrillation. All right, this is VTAC. This is going to be defibrillation over amiodarone. Okay, because those are the two that would be the potential treatments for this condition. So you would want to pick defibrillation over amiodarone. Amiodarone would be a secondary treatment for this, okay? And I had to go back over here and correct it because a lot of the questions and comments I were getting were, no, amiodarone is first or cardioversion is first. You cardiovert the patient, but that wasn't one of the choices that were there. And so it's like, okay, so if cardioversion is not there and you don't see that when you're taking NCLEX, what are you going to pick? What are you going to do? Okay, so you have to be able to move past that and commit to an answer. It's going to be most helpful to you guys on your exam. All right, so that was the question from last week. Now I want to show you the Instagram question from this week. I don't know if you guys have seen it, but I'm going to show you a picture and then I'm going to ask you about it. All right, so here's the picture right here. Boom. Here's the picture. Go back. All right, now this is the picture. Share this post. Share this post. Share this. All right, so we all have orientation to what we are looking at. So here's the question about this. Here's the question about this. What is the most likely diagnosis here? Is it 1, sarcoid, 2, infantile acne, 3, sebaceous gland hyperplasia, 4, Malia, 5, erythema toxic. Which one is it? Let me show you the picture again. Boom. Oh, the answers are coming in, Facebook. All right. What is the answer? What is the correct answer? There are many choices that you're given. I see sebaceous gland hyperplasia coming in. Malia, yeah, okay. Erythema toxic, nobody's really picking that one. Infantile acne, yes, I see that as a choice as well. All right, this is a pretty straightforward image question for your NCLEX exam. This is actually, the correct answer is actually number 4, okay? Remember with Malia, this is like a keratin-based cyst, but they're tiny. And actually, they are quite common in newborns. And you can see them on the face. Sometimes they will have them on their cheek, and it is a totally harmless condition. This is not infantile acne. If you pick the incorrect answer, I want you to spend a little time just looking at just basic definitions, because basic definitions of these terms would have helped you to figure this picture out. Okay. And it's all right. Like, it's all right if you didn't get it right. A lot of people didn't get it right. And all that tells you is that you have a weak area here. And that's a great thing, because that's what questions are supposed to do. Questions teach you nothing. Questions teach you nothing. What they help you to do is identify your weak areas so you can go back and study the content. I'm really glad that you got that. I'm really glad that you got that. So, you know, everybody will be telling you, every NCLEX review will say the questions are the most important thing that you do to prepare for NCLEX. But I'm telling you that knowing the content is better than doing 100 questions a day. All right. I'm telling you that. So Instagram. All right. So here's our question for Facebook for this week. So let's look at our question for Facebook this week. Here we go. A client presents to the local community clinic. The client has a history of diabetes mellitus type 2. All right. Her fasting blood glucose is 140 and the hemoglobin A1C is 6.5. What should the nurse expect the physician to order for this client? So we have a patient here, and just background, there's a history of diabetes mellitus type 2. The fasting blood glucose right now is 140, but the hemoglobin A1C is 6.5. So what are we expecting the physician to do for this patient? Okay. So here are the options. What should the nurse expect the physician to order for the client? Number one, just reevaluate her hemoglobin A1C in 7 days. 2, instruct the client to eat a low sugar diet and exercise. 3, start Novolog subcutaneous based on a sliding scale. Or 4, instruct the client to apply Lamisil. Instruct the client to apply Lamisil. Now, remember my pro tip for this week. You are only going to be looking at the answers that are there and picking the best one. No outliers. I don't want you typing in your own answers. I want you to commit to something that you see. Commit to something that you see. Now, you know what? This is a great example of how content really helps you to answer questions over strategies. Because I know that there are many kinds of strategies that NCLEX reviewers like to tell you guys, like compare answers 1 and 2 and pick the one that's easiest for the patient to do. All right. Write your answer and then share this video to your friends. All right. All right. So I see the answers coming in. Man, I see the answers coming in, and I'm really shocked again. But let's go over it, because what we need is the right answer, and then we're going to do a little content review. Okay. Yeah, 2. I see 2 and a 1. So the correct answer actually is going to be number 2. We need to instruct the client to eat a low sugar diet and exercise. A low sugar diet and exercise. And you know what? This is so important. This is so important for you to be able to understand the pathophysiology of type 1 and type 2 diabetes. And this is one of the reasons why I do cover this in my lectures, because even though they sound the same, and usually they're grouped together, the pathophysiology behind the two is very different, and the treatment is very different. And so as a nurse testing for the NCLEX exam, you want to make sure that you understand the difference between these two. You want to make sure of that, because if you're put in a situation as a nurse, you're going to have to be able to anticipate the kind of treatment that the doctor will prescribe. And more importantly, and this is why we do our content, because in real life, being a nurse is not about just answering questions correctly. It's actually being able to protect your patient, right? We want to be great nurses because our patients depend on us to save their lives. So when we have an understanding of diabetes mellitus type 2, if the physician prescribes Novolog based on a sliding scale, oh my goodness, what can we do as a nurse to protect our patient? We can call up the doctor and say, hey, not so fast. I don't want to send this patient home giving themselves injections when they can do something different. So it's very important for us in real life to be able to know the content. All right. So let's look at this topic of diabetes mellitus type 2. When you get a question like this, there were 3 things that I was thinking of right away. And these were the 3 questions here. What is hemoglobin A1C? All right. And most of my Remar nurses, I know you know this stuff, but there's somebody on here that doesn't know, and we need to review it for them. So the question is, what is a hemoglobin A1C in diabetes mellitus type 2? Will we have the body producing insulin or not? And then also, if that is the case, what is the primary treatment for diabetes mellitus type 2? And this is kind of how you have to study the content. Do you see? So the questions are guiding us to our weak areas, but we need to go back and cover it. So let's just address each one of them. If you know it, go ahead and type in your answer and let your friends know that you know this stuff. Okay. So number 1, the first question here is, what is hemoglobin A1C? All right. If you've never heard of it, it is a blood test that's done specifically for diabetes mellitus. Okay. And I just want to put this out here. You would not do a hemoglobin A1C for diabetes insipidus. That's all I'm going to say. All right. But anyways, so hemoglobin A1C, we use it. It's also called glycosated hemoglobin, but it is used to measure the blood sugar control of an individual for the past 3 months, right? For the past 3 months. So it gives us a broader picture of somebody who's coming in with a high blood sugar. Or if somebody says, you know what, I think I may have diabetes, I'm not really sure. We could look at their blood sugar for today by doing a capillary blood glucose test, or we can look and see what it's like for the last 3 months by doing a hemoglobin A1C. So it is very beneficial for you to know that for your NCLEX exam. And I put a little algebra there at the bottom, but the number for the hemoglobin A1C, we want it to be less than 7. All right, so that number should be less than 7, and we would go ahead and call that normal. Okay, call that normal. So the next consideration, before we go, I did put this in here. So Remar nurses, I want you to critically think, and I'm going to leave this here for a minute. What part of the blood is being tested for the hemoglobin A1C? All right. What part of the blood? If the doctor orders a hemoglobin A1C for a patient, what part of the blood are we looking at? Oh, what part of the blood are we looking at? Does anybody know? Is anybody willing to take a chance? What? Okay, I see the answers coming in. But so this is something else where somebody might have said, oh, yeah, I know hemoglobin A1C. Yeah, I know what it is. But do you really know what it is? Or do you just know the numbers associated with it? So I see some answers coming in. I see plasma. All right, that's a good guess. The finger. Lily, I think you might have it, Lily. I think you might got it. Yeah. So actually, you guys, when a doctor orders a hemoglobin A1C, what they're looking at are the red blood cells. Okay, Ja, I'm so glad you passed your NCLEX exam. Yay! Thank you for coming on here. Thank you for coming on here. 85 questions. That's a good experience. That's a good test. I'm really proud of you. I need to see that video. I want to shout you out formally. I want everybody to see it. Give your testimony. But thank you for coming on here and letting us know you passed. Congratulations to you. But okay, so this is what we're talking about. It is the red blood cells that are being tested, okay? And that is the reason why, and this should make sense to you guys, because how long do red blood cells live for? About 3 months, right? So that is why the hemoglobin A1C gives us a picture of blood sugar control for 3 months. You see how it all works together? And why studying content is so important. All right. So that is what it is for you guys. All right. Perfect. All right. So the next consideration that you want to think about is the body producing its own insulin in type 2 diabetes? That's right, content over everything. So in diabetes mellitus type 2, will you experience insulin production, or is there no insulin production? What saith you guys? Because we know in type 1 diabetes, there is what? There is no insulin production. So in type 2, yes, we expect to see insulin production, but there is an issue. So let me show you the formula answer. You guys got it. Yeah. So, all right. So yes, the body, it is producing the insulin, but the insulin is not enough, all right, to help that glucose get into the cells. So it stays in the blood. So let me just break this down for you. So what happens is this, right? When you eat a food that is high in simple sugars or just really high in carbohydrates, that food usually breaks down to a lot of glucose, right? That food usually breaks down to a lot of glucose. If you eat a piece of birthday cake, it is going to break down to what it really is, which is sugar, right? And that sugar is going to be in your bloodstream. So what is supposed to happen is the pancreas is supposed to produce the insulin, and the insulin helps to carry that glucose into the cells so that that glucose can be used for energy, right? But if you eat a piece of birthday cake and the glucose is all in your bloodstream, the sugar is all in your bloodstream, and the pancreas puts out just a little bit of insulin, barely a squirt of insulin, then that glucose is going to hang around even longer, and it's not going to get into your cells where it needs to be. All right. So, and the issue when you have sugar in your bloodstream for a long, long time, it starts affecting the organs in a really bad way. All right. So what gets affected with diabetes, right? Your eyes. All right. You start to go blind, your kidneys, your vascular system, like that sugar is super, super dangerous. It's basically a toxin. It's a poison to the body. So right there, for everybody who has a sugar addiction, we need to stay away from the sugar. It's not good. All right. And it's really not good if you are, if you have insulin sensitivity or if your body is insulin resistant. All right. So that's why it's so important for the insulin to be in an abundance for somebody who's eating a ton of sugar. All right. So, but because with diabetes type 2, there is insulin production, normally you don't need to start by giving your patient additional insulin because they already have insulin being produced. So if the body is already producing insulin, use artificial insulin. All right, because nobody really wants to be on insulin. It's a hormone. It comes from pigs. Like, you don't really want to be taking insulin. You really don't. So what we encourage our patients with diabetes mellitus type 2 is to, yes, I love it. I see you guys putting it up here already. So the primary treatment is for diet and exercise to normally help the body to regulate itself. All right. And the reason why diet is so important, because the less glucose that you're eating, the less insulin that you need to cover it naturally. All right. So that's a great thing. If we can control our diet, then the body isn't stressed to put out a ton of insulin. Even everyday people who are not diabetics, if we can get our diet under control, guess what will happen for us? We will lose weight. All right. Because one of the byproducts of the body releasing insulin into the bloodstream is that insulin helps us to store fat. Did you know that? So when you eat a lot of sugary foods and your body has to produce a lot of insulin to cover all that sugar that you're eating, it's also telling the body, hey, we need to store fat too while we're doing this. So eating a sensible diet is great. Now, another thing that we recommend for diabetes mellitus type 2 is exercise. Because exercise also will lower the blood sugar levels in a patient naturally. So it is an additional benefit that somebody who's newly diagnosed with diabetes can try. All right. So this question was a content question, and I'm glad you guys got it right. But I'm also glad that you were able to study the content a little bit more. All right. Because that makes you excellent teachers. And as a nurse, one of your primary responsibilities will be teaching. It will be teaching. All right. So I am so happy. That you guys were here for Let's Talk NCLEX. We do this every Friday here at Remar Review. And it's so important to our studying process. Hey, you guys, you know what? I know we didn't get a chance to cover everything. And one of the questions that I get a lot are, hey, Regina, can you help me study for NCLEX? I know you work with schools. I know that, you do citywide events, and I know you speak to a lot of people, but do you have something that's just for individuals? And I do. You guys know that. So I want to give you my email address, which is support@remarreview.com. Okay. And this is the way that you can connect to me. Send me an email with questions that you have about what we talked about today, or how I help students pass their NCLEX exam, because there are too many of us who are studying and we feel totally lost with what we're doing. So please take advantage of me as a resource. All right. Some people just study for NCLEX and then they take it once and that's it. I study for NCLEX every day. Every day, this is what I do. And so I've gotten really good at it. And I've gotten really good at helping nursing students, no matter where they are, pass this exam. So this is a family environment here. Consider me a big sister or a mentor or a grandmother. I don't know. It depends on your age, I suppose. But I am here to help you. Our class motto, I love it. It is simply this: we can, we will, we must pass NCLEX. We can, we will, we must pass NCLEX. All right. And I know that you guys can do it. We have so many testimonials of nursing students who were just like you, who studied with us, used the products, made it to their test, took the exam, walked out of there, and the best thing happened to them. And that is that, Angel, I see 76 questions. I'm so glad you're here too. You passed with Remar, pow, just like Angel. Angel's a nursing student just like you, and she had to take NCLEX. And from her own words, she passed it with 76 questions. So all you guys that are studying and you're nervous and you're like, I don't know what to do. I'm feeling nervous. The exam is coming up. I want you to stop right now. I want you to stop right now and just picture a day when you get that envelope in the mail and it's your nursing license. Can you imagine that feeling? Can you imagine that feeling? You get your envelope in the mail and it's your license. I want you to picture a day when you are putting on scrubs and you're going to your dream job as a nurse. It's there. It's there, and it's all within your reach. I want to be there to help you to get there. So thank you so much for Let's Talk NCLEX this week. I will be back on for Motivational Monday. So whatever happens over the weekend, we're gonna draw in together and get motivation for our Monday and through the rest of the week. Don't forget, email me, guys. Remar Review is the website. Hey, we must pass NCLEX. I am ready for it. I'm excited about it, and I hope you guys are too. Have a great Friday. Bye, everyone.